I'm still admitting people who is joining us, so sorry for my sometimes interrupting. Hi to everyone again. We are starting our webinar, and first of all, thank you for everyone's efforts to join this webinar. It shows your determination and persistence to find a job in NHS in the UK. I am grateful Evgenia, our UMC exec assistant, for her help in organizing this webinar. Let me introduce myself. I am CEO of the Ukrainian Medical Charity, and I am the project lead of the Ukrainian Medical Association of the UK. We are happy to support Ukrainian medical community in the UK. The main idea of today's webinar to make you acknowledged about joint efforts of our British partners with a new app and the new possibility to find a job in the UK. As more people join the app, more trusts and hospitals will share more and more job opportunities for each of you. I would like to introduce our today's guests and speakers who will tell more about the app, our joint goals, and how to sign in with further Q&A. So after our speakers will make intros, we will have Q&A session where you can ask any questions about the app, about how to sign in, about the goals, whatever you need to know, and whatever helps you to join this app. First, I would like to make an intro of Ciara Luscombe, Program Lead NHS Employers, to tell about the idea, and after Anthony Sembatya, Program Manager, Refugee Employment Program in West London NHS Trust, in details tells more about how to use the app and sign in. Is Ciara here?
Yes. Hi, Oksana, I'm here.
Yeah, great.
Can you hear
so
me?
The floor is yours.
Oh, thank you. Thank you so much, Oksana, for this invitation, and to everybody for joining this webinar. There's a huge number of you on this call, so we really appreciate your time this afternoon, especially as it's lunchtime. So as Oksana said, my name is Ciara Luscombe. I'm a program lead at NHS Employers. And just a bit of background about NHS Employers. So we are the employers organisation for the NHS in England, and our role is to support workforce leaders and represent them to develop a sustainable workforce and be the best employers they can be. We also manage relationships with NHS trade unions on behalf of the Secretary of State for Health and Social Care. And my role is really focused on inclusive recruitment into the NHS. And one of the groups that we particularly focus on is refugees. And what we're asking the NHS to do is to view refugees as a domestic workforce within the UK, which is what they are, and to offer more job opportunities, training, development, career pathways to all refugees, whether that's into clinical roles or non-clinical roles as well. And today I'm really excited to be able to share just a brief introduction about the app that we have developed, and I'll then hand over to Anthony, who will be able to run through how to get on the app and signed up as well. So the NHS Employers have developed an employment support app. And this app is for refugees. And what it does is it connects refugees to available NHS jobs in London at the moment. It also hopes to connect individual users to charities and organisations that can support them with this work and with their job seeking, as they look to find roles. It also includes news from charities and organisations to keep colleagues and individuals who use the app up to date, and that's up to date with what support is available, if they're seeking roles as medics or nurses, what kind of information they should be aware of. Anthony will show you more shortly, but what the app does is it asks individual users to consider if they'd like to apply for entry-level roles, nursing roles, or medical roles. So that's how it breaks down the information. It's free to download and free to use, and it's available on the app stores, so Google and Apple on those app stores as well. And we can share those codes and those links with you as well to download the app. But yeah, just to say, if you've got any questions, I need to leave shortly, I'm afraid. But if you've got any questions, obviously Anthony's here, but also if you want to contact me directly, I'm really happy to answer any of those questions as well. And I'll pop my email address in the chat. But yeah, I'll hand over to Anthony for now. Thank you so much.
Yes, thank you very
very
much.
much.
Thank you for inviting us and organizing this event, Oksana. I'm really glad to speak to many of you here. My name is Anthony Sembatya. I actually work for Northwest London ICB, which is the wider NHS organization that leads West London and Northwest London here in London. So I've met probably a few of you on some of the events we've organized. Some of you might not know me at all, but my work is to really support refugees to access employment in the NHS. So this program of work started about 2 years ago. I started in Northwest London, but we've expanded it to reach other parts of London. And we've also are now working jointly with NHS Employers, which is a wider organization Ciara has just been talking about, where she works, which really leads a lot of this work across the UK. So what this really means is we are not going to be working for London only. We will be working for the UK eventually, but this app has started in London, and the more you people use it, the more benefits it will deliver for not only yourself, but for other people who are outside of London, because we want to get as many NHS trusts as possible to realize that you people are there, you're looking for jobs, you're actively looking for jobs, and you're making the applications, and they can see the applications, so that even people who don't live in London, people who live in Reading, people who live in Manchester, Yorkshire, wherever people, maybe Brighton, can actually locally apply for jobs, knowing that they will not be ignored. But the way to do it is if you download this app, put it on your phone, and then look at what it offers and start using the app as in to apply for the jobs, look at the information that is in there, which I'm going to show you shortly, and all the training opportunities, all the charity organizations that are there that are here to help you, and also to ask questions. But the jobs are on the app already. They are filtered by medical jobs, nursing jobs, administrative jobs. If you want a healthcare assistant job, they are filtered by that nature. So all it needs is for you to download the app. And as I'm speaking, the first thing I did was to go into the chat. If you look into the chat of this webinar right now, the first article up there, I've put the link to the app. So you can start downloading the app as we speak right now on your phone. So I'm going to take you through some of the ways to, there's only one way, the way to download this app onto your phone and the benefits of how you can generate benefits from it. I think quickly, let me just show you something here. So for people who, okay, so for people who are unable to go to the chat room, this is the app. It's NHS Employers. This company called Royalto are the ones that have got the technology they are the people we paid to develop the app. So the app is not called Realtor. It's for NHS employers, but Realtor helped to develop it, and they run it, but it is for NHS employers. So to get to the app, you can scan any of those two links. If you've got a Samsung phone, if you've got an Apple phone, use this one. If you've got anything else, Samsung, Google phone, use this app. Sorry, QR code, and then download the phone on the app on your phone. Gonna leave that one for another 30 seconds so people can download it on their phones. I know sometimes it takes time when you put your camera in front of the QR code. Sometimes it takes a long time to pick it up, but that is one way. If you feel you don't want to scan, I've put the links in the chat. Just go to the chat and then click on the links, and you'll be able to download it immediately. So I'm going to take this one away for now, and then we'll come back to it later. So sorry, I think I've just
Anthony, can you please show the probably how looks the logo of this app, and people who is downloading it now, it will help to search exact picture at Apple and Android stores.
Okay, can you see this new thing that I've just put on? I think I can see it. I'm sure you can see it, all of you. Can you see, Oksana, can you see the new?
It's a screen on the screen.
Yeah, but does it say NHS employers? Is that what you're saying? Okay.
No. It's something doesn't work properly. Probably internet. It's frozen on the picture with screen of attendees.
Okay, let me do something else.
Send please the link, maybe it's better.
Sorry?
Can you send the link?
Yeah, I've put the link in the chat room. It is in the chat. If you go into the chat room, it's already there. So let me try again and see.
Yeah, in chat there is how it looks like this circle with these names. Please search Rialto, but it will show you NHS employers.
Okay, can you see it now? What I've just put on the screen. Yeah. Okay, so when you download the link, this is what it will look like. Yeah, it will automatically come and say Rialto and then sign up. But this is how to sign up. So when you click on the link initially, it will take you to Google Apps. Yeah, and you will see this small thing here which says Rialto. Yeah, click on it and of course download. Once you have downloaded and you click open, you can it will bring up this screen which asks you to sign up. So just remember, the first time you click on this app, don't click on login, click sign up. When you click on sign up, this is the screen it will bring up. You will have to put in your name, both your names and your email address, and then you'll confirm your email address. This is the part I need you to focus on when it says organization. Where it says organization, and that is where I'm going to go to next on here. So this person has put in their name, their email address, and now it has gone to organization. There are two things that come up. One is NHSP. Please ignore that one. Click on the Refugee app for London. It's called Refugee app, London NHS Employers. Select that one there. Yeah. Once you've selected it, it will then ask you a few questions. Do you have refugee status in the UK? Obviously you do. You just click yes. Yeah. Select yes. And then it will ask you another question. What type of role are you interested in? Which is the same as what type of job are you interested in? And the kinds of jobs that are on there at the moment are categorized into 5 groups. Entry-level jobs. These are
Your microphone mute. Would you turn on your microphone?
sorry. Oh, thank you. Okay, where did I stop? Where did I mute it? Was I? Oksana, where did you stop hearing me?
Entry-level jobs.
Entry-level jobs. Okay. So it will ask you what sort of jobs are you interested in. They are categorized into 5 categories. Entry-level, AHP, which stands for Allied Health Professionals. These are people like physiotherapists, nutritionists, radiotherapists, and the rest of them, occupational therapists. So another category is for nurses, doctors, and dentists. So you select where you feel you fall. Now, some people have done work which is not clinical. By clinical, I mean they are not nurses, they are not doctors, they are not dentists. They just want to be administrators. They've worked in finance, they've worked in IT. So to make things easy for everybody, we've grouped all those ones into this area, but it doesn't mean it's an entry-level job. But click on this one here, the first one, and I will show you what you do next to see whether you can find a finance job. But if you're a nurse, just go directly there. If you're allied health professional, just go directly there.
For example, if doctor refugee, yes, like, and haven't GMC registration, what the roles can be possible in the hospital?
Okay, I will come to that. Let me first take you through the steps of how to log in first, and then we will go to the next one. Yeah, I'll answer that question.
Okay, thank you. Okay.
Yeah, although you are seeing very many screens, actually, these are the only questions that are there. It's just that they are broken down into this. We are trying to explain them to you. So there are 5 categories. So if you say you're a nurse or something, they ask you, are you qualified? Are you a qualified doctor? Are you a qualified nurse? The reason we're asking that question is to know how many nurses are there who are refugees, who don't have jobs. How many doctors are there from Ukraine in the UK who don't have jobs? So they ask you, are you qualified? Now, a lot of people tend to make the mistake and think when you see doctor here, you want to train as a doctor, or you want to train as a nurse or as a physiotherapist. We are not talking about people who want to train as doctors, nurses, or dentists. We are talking about people who are already qualified. And that is the reason why it asks you this question. Are you qualified? You just say yes or no. If you're not qualified, that is also fine. You just put no. So next question it asks you is where is your current location? So this app initially is going to work in London, but other areas are going to be put on eventually. People from, as I mentioned, Manchester, Cornwall or Brighton will come on. But we need to know if you're located in London or Brighton or Manchester or Yorkshire. So you select London here or other if you don't live in London. And then the next thing will be just put in your password and then confirm the password. Always remember to note down your password somewhere, because people register quickly and they forget which password they used. So 2 things, your email address and your password. And lastly, there is a small tick box at the bottom which says, I agree to the terms and conditions or terms of service. Please tick this box if you agree, and then click on sign up. That is all you have to do. Once you have done that, the tool will automatically send an email to your email address, the email address which you put in somewhere here when you are registering. So go to that email address and verify that this is your email address. You just have to click on verify in your own email address. And once you've done that, it will bring this screen. Now, instead of signing in, because you've already signed in, this time you're just going to log in, which means you just have to put in your email address and then your password. At this point, the app is already on your screen, on your phone. You'll be able to see it. So on your phone, you'll be able to see Rialto, and if you click on it, it will ask you to log in, and you put in your username, sorry, your email and password. This is what you do, and this is the app. You will automatically go to the app. This is what happens, or this is what it looks like when you have successfully logged in. Now,
Anthony, can I ask you something? Now you're talking through the app, signing and logging in. There are some questions and hands up. Do you want everyone have questions when it's Q&A, or we can ask you during the process?
Okay, so what I'm going to do next, I'm just going to show them a small video, which is going to be like 2 minutes, and then I open up the thing to questions so that anyone can ask their questions. But in the meantime, please start downloading the app now so that if you have any questions, if you have any problems, we can resolve the issues while we are here right now. That is my encouragement to you. So I'm going to show you a small video so you can see how this works. I think unshare that. Hope I've got the video live here. Here. So can you see that video screen, everybody? Okay, the volume is not going to come up. There is no reason for the volume, but just see the screen and see what happens. So that is where you sign in, as I mentioned, or log in. So as we do that, this is what I'm going to do. I'm going to leave that screen there for you. So can you ask any questions that you want? I've left that screen for you people so that you can continuously download the app as we talk, as we go through the questions. Right. I think someone was asking about medical doctors. What was the question again? Just remind me, please.
I want to ask, for example, if doctor, but without GMC registration, here, what the roles can she have or he have in the hospital?
Okay, so if a person is a doctor, who has been a doctor in Ukraine or somewhere else, and they have not got GMC registration, so we have talked to the hospitals that are participating on this program. They can give you a job to work as a senior healthcare assistant. So you'll be working on the ward directly with other doctors, and you'll be able to, of course, support the patients as you pursue or as you do your PLABs and get your GMC registration ready. Before this time, there used to be a medical support worker role, but they took that away about a year ago, maybe 2 years ago. So it doesn't have funding. That's what people used to do. I think right now they're doing senior healthcare assistant roles, but the people will know that you're a doctor, so they'll give you more interesting things to do rather than but you will be supported by other doctors to be able to reach your goal of becoming a doctor again.
Okay, what's the roles healthcare assistant?
I didn't understand that question.
Huh? What the healthcare assistant do in the world?
Oh, okay. So a healthcare assistant, again, when you go onto the app, if you download this app, it tells you for each role that you click on, for each job that you click on, it tells you exactly what that job does. It is the other app I was going to share with you. So a healthcare assistant works with the nurses, on the ward directly to support the patient. If you are starting out and you're not a senior healthcare assistant, you do more of the, I think they take blood pressure, for the patient. They help to lay the bed. They help to if the patient needs food, they help them with the food. But if you are a senior healthcare assistant, you do more work between you and the nurse and the doctor. You don't do the rest. And also you supervise the healthcare assistants, if you see what I mean. Yeah. But they do quite a lot of work. It is all listed on the app. If you download the app, it will tell you what the healthcare assistant does on the ward. Okay.
We have another question from Olena Debella. Olena, speak up, please.
Hi, good afternoon. So I'm nearly done with dental nurse qualification. Just in 2 months apart, I'm going to be qualified and registered as well. So what's the chance to get job in Max Fax department on NHS?
Okay. Of course, there is every chance that you'll get the job. I just want you to know that the NHS doesn't do a lot of dental stuff. They've given a lot of that work to most of the dentists are private dentists, but there's what they call community dentists. That is what the NHS does. So they do a lot of dental health promotion. So they work with young people, children, and the elderly who are facing problems with their teeth, to help them to keep their dental oral hygiene, if that's what it is. But there is a specialist hospital in East London which deals with dental things. So there are opportunities there, and in some hospitals you'll find a dental area, but mainly our dental work is in the community, as in supporting people and young people, especially children, in schools, and of course, whichever way they come in, so that they don't have dental issues. So you will possibly find a job, but I just want you to know that it's not easy to find a job as you would be if you are just a nurse, a ward nurse. That would be much, much quicker. But the dental jobs will be there as well.
Okay, and what is certain requirements to get the job? Because near my house, I have a hospital, Watford General Hospital, and they have a maxillofacial department. And sometimes I have some advertising about dental nurse position.
Okay.
Yeah, so what kind of requirements? Maybe do I need some certificate of level of English or stuff like that, or what kind of
So sorry, can I a bit specify the Q&A? We don't. I think you can ask about special requirements from the NHS Trust. What is nearby you? We have just a big queue now.
Okay.
Questions, and it's better if you send your question. Actually, I would like to tell everyone that no worries that. If you don't have all your answers today, because next week or in 2 weeks time, we will repeat for those who didn't attend and for those who has more questions after signing or logging in. So we will have a couple of webinars to cover all the questions. So now I would like to give the word to Mariana Dmitruk, I think. Mariana?
Hello. First of all, I would like to thank you for this opportunity for all refugees, doctors, and others specialists. So thank you so much. And my question is about the app, because I try to see how it works, and this app redirects me on the track website. So could you please advise what is the role of this app and how it helps me, or is it just the same if I use a track website to apply for jobs?
No, it is linked to NHS jobs, but this app does more. What it does is, one, there are people that interested in working for the NHS, but don't know that the NHS has got its own website that recruits people. So first of all, it links you to that website. That is one. When you're applying for the actual job, the application, the NHS application itself can be difficult for some people. So we've put in some links of organizations that can support you to apply for a job in the NHS. Once you've applied for the job, sometimes it can be difficult to sit for an interview. So within this app, there are organizations that can help you to prepare you for an interview so that you can successfully pass the interview. Then this app also has got a training news element to it, where if you're interested in understanding what the Home Office is talking about immigration, so if your doctor, GMC is going to offer in the next few months, what NMC for nurses is going to be offering, OHPs, we've put all that news in one category there. It has also got that element where you can send in a question, and then we shall be able to respond to your question. The other element of it is, if we know how many people are in any specific categories, then we can talk to your local NHS trust and say, this person here, let me say Oksana is here, she lives in Birmingham, and there are 50 other Oksana people who live in Birmingham. They've been looking for jobs and they have not been getting anywhere. Can you actually help them so that that NHS trust can know and not ignore your applications? So it is not just an app. This is specifically for refugees, and we will be tracking to see if people apply, are they actually getting through? If they are not getting through, you can give us feedback, and then we can talk to the employers, the NHS trusts, to see what they can do for you. So it's not just an app, it's a tailored app for a specific purpose to help refugees access employment in the UK.
Before I will invite Lilia to ask her question, I would like to tell you more that it's only first steps to improve situation with getting people with refugee status to NHS, and on 21st of September it will be Mayor Summit with support of London's Mayor and other top managers from NHS, where it will be all discussed. What problems, what issues, how many people joined, how many trusts joined, how to improve the system communicating between people who is looking for a job and with trust who is searching for employees. So it's just a start, and you will be already in the system, and after we will discuss it, probably it will be improved with your support. Lilia, next question.
Hello, good afternoon. My name is Lilia. I have a question. Do you have any plans to put the section for the pharmacist, because a lot of Ukrainian pharmacists here, and like it will be entrance position if you will be put section for pharmacist. Any plans about this one?
Okay, yeah, the pharmacists can be put there, but the reason why we just selected those few and didn't put finance people who are in IT, was we just wanted to keep that list small. So when you go into the app itself, I just want to show you something. If you go into the app itself, once you've downloaded it, when you see a job like nurse or doctor or healthcare assistant or domestic, delete that word and put the word pharmacist and click search. It will bring up all the pharmacist jobs. It's just that the NHS has got 300 types of careers, 300. So we couldn't list them all. We just sort of bundled them up into staff groups, but just to give you an idea. But once you download it, delete the word doctor and put the word pharmacist and click search. The answers will come to you automatically.
Yeah, it was another question in the chat about 7 roles in London. So as you see, there are so many roles which could not be specified so far, but you can use this trick and add your role, and it will show you possible things. I've seen very interesting question about the app. Question to the app developer: for what purpose does the app require permission to access audio on the phone? Allow Rialto to record audio? Anthony, can you answer this?
To record you on the phone?
Yeah, because it asks about permission to.
No, as with all apps, yeah. When you download an app, it automatically does that. But then, okay, let me talk about information governance. I think it will answer the question better. So everything you put, all your information that you put on the app will be seen only by NHS employers and the NHS trusts that you apply to, as well as yourself. Rialto, we are paid to develop the app. They are not going to be using that information. They don't have access to that information to be using it for anything. But as with many apps, it automatically usually asks you, allow me to do something. And I usually select allow once, not forever. And it does what I want, but Rialto is not going. We've signed an agreement with them. They can't access your information to use it for anything. They just helped us to develop the app. The app is owned by NHS Employers. NHS Employers is one of the big organizations within NHS. I hope I've answered that.
And huge security. Great. Next question is from Tatiana. There is no surname, so Tatiana, who has her hand up.
I can see Tatiana, but
Yeah, she doesn't speak. Okay. Another, and Anna Fadeyeva. Anna Fadeyeva, I entered into the app and found the role Trust Doctor. When clicking the button, I was redirected to NHS web page.
yes.
We don't hear you if you are speaking. If we don't hear you if you are speaking.
Oh, maybe. Can you hear me?
Yes.
Yeah. So I was just now, I was redirected to NHS site, and usually I apply through this NHS site. I was redirected from your app to NHS site. So it's everything that I do every day, applying for the job roles.
Okay, so Anna, now that you're registered onto the app, yeah, we will be able to track.
Yes, I'm registered.
Yes, we will be able to track the jobs you have applied for and why you're not getting the job. I don't know which job you keep applying for, but sometimes...
Trust Doctor.
Trust Doctor. So are you GMC registered?
Yes.
Oh, good. So we will then now find out why you're not getting the jobs and also help you with the other options. Yeah? Because we hadn't known that you've been applying for jobs. Now we know. I don't know whether you get it. So now we will know because you've registered with the app. And if you don't get the jobs you're applying for, we will be talking to the NHS trusts because we've got evidence that you're actually looking for a job. We will have to know why. Is it your application that is wrong? Do we need to help you with something? What is it that is making it difficult for you to get a job? We'll find out that.
And how we will, what she needs to do.
How can I know?
Okay, so how can you know? So when you make, for example, your application, every maybe 2 weeks, I think Oksana, you've seen some of the messages that pop up. The message will pop up on your phone to ask you whether you were successful in your job application. If you say no, then we'll go in detail with you to find out why you were unsuccessful, and then see if we can talk to the NHS Trust to help you. If the problem is on your side, then we will be able to resolve it if it's something to do with the application form. For example, I can tell you right now, and I think Oksana, you probably know this already, that from our meetings, the people who are starting out as doctors, people who have just graduated, there are very few roles in the NHS at the moment because the funding for those jobs was cut last year. So the government has to put more money so that the new doctors can go into the system. But if you are a senior doctor, then that is different. But also if you're that level, there are other options which are open, but we can talk about them off this forum. Yeah. Especially if you're GMC registered, yes.
Another one, Tatiana, are you still want to ask question? We don't hear Tatiana. Next one is Elena Kornienko.
Yeah, hello. Thank you for the opportunity. My question is not related to this app. I'd like to ask about impossibility to apply for a job at certain NHS trust. For example, I'm not working in NHC, and I can't apply in several NHC. And how can I do it? What is option for me to get a job in such cases? Thank you.
Sorry, I didn't understand part of that question.
Yeah, my question is why people can't apply in some NHC jobs if they are not working in NHC.
Is what you're asking that there are some jobs that people cannot apply to? Is that what you're asking?
Yeah, I'm trying to apply for some role, and there are questions I'm working on now in NHC, and if I
Oh, they're asking whether you
I'm
work
not
you're working
working.
in the NHS. Yeah.
Yeah, and after that, if I choose I'm not working, I can't apply.
Oh, okay. So at the moment, if you go onto the NHS website, there are about 15 or 18,000 jobs that are available right now. 15,000 or 18,000. Sometimes there are 20,000 jobs. But some of the jobs, they put restricted to internal candidates. What that means is the NHS Trust opens up a job, maybe for a finance manager or a nurse, but they want people who are already working within that NHS Trust to apply for that job. Usually that is because the NHS Trust wants their people to grow, as in to be promoted from within the trust itself. So they open it up, you will see it, but they just want internal people to apply for the job because they want people to get promoted internally. But that only happens in like 5% of the entire jobs that are on the NHS website. So if it says restricted, please don't apply for it. Apply for the ones that are not restricted. It's because the trust has decided maybe they want to promote a certain level of people in their trust, and yeah, it happens. But that is very, very few jobs that are restricted. The majority of them are open to everybody. Okay?
Thank you, Anthony. Tatiana, are you still want to, you still have your hand kept up? Do you want to ask something? Okay, next question to Victoria K.
Hello, I have a question. I'm a student of medical imaging, and I'm currently starting second year. And does this app would this app give me any potential benefits in finding job? Thank you. Well,
Okay, so
medical imaging is radiographer.
Radiography, yeah. So if you're a future radiographer, if you're interested in a job, maybe a part-time job to do while you're doing your study, there are jobs that you can do on this website. That is one. Two, this website has also got links to what they call NHS careers, which has the whole raft of jobs that are available or roles that are available in the NHS. By downloading it, you'll be able to get that information. Also, I've mentioned the training opportunities and the links to other charity organizations and other big organizations that could be useful for people. Lastly, once you qualify as a radiographer, if you're struggling with your job application, this could help you as well. There are going to be links to organizations that can support people with English as well, English language. So you never know what you might find on there. So that is why it is useful for us. But lastly, we need to know how many people are interested in jobs in the NHS who are from a refugee background. So the only way we can know that Victoria is also interested in a radiography job, but she's from a refugee background, is if you download the app. So yeah, and also moving forward, there will be more things that are put on this app to help refugees as a whole. So just keep it on your phone. You never know when you might need it. I just want to ask a question before we go ahead. Can I know how many people who are on this forum now, and Oksana, you can ask this question again for me, have downloaded the app now as we speak? Could you put your hands up if you have downloaded the app? Oksana, could you repeat the question for them properly, please?
Я повторю українською. Підніміть, будь ласка, руку, нажміть підняти руку. Ті, хто підписався на апку, ми хочемо просто зрозуміти, яка кількість людей наразі зробила процес, зареєструвалась в додатку. Ми не можемо, we cannot read all the questions in the chat, so after this, please, yeah, so far it's like...
Обов'язково це робити під час конференції, чи що не можна зробити це потім?
Ні, ви можете, це ж для цього вебінари був, для того, щоб ви могли, якщо у вас будуть якісь питання при підписанні на додаток, задати Ентоні, як це можна зробити. Ось, наприклад, хтось запитав про роль, він розказав, як внести свою окрему роль. Хтось запитав ще, він підказав, що там нажати, що сказати. Це про те, що ви потім сядете і будете не розуміти, що робити, а ось у вас є готовий приклад для запитань. І, звичайно, ми будемо повторювати такі вебінари ще наступного тижня, через тиждень, але це ж вам дається можливість питати тут і зараз про те, як краще зробити для себе, щоб вас помітили про роботу, знайти роботу. Окей, getting back to English. Yeah, so far it's like up to 60 people jumping.
Yeah, I've seen the numbers. Yeah, thank you very much. I'm now going to answer some of the questions that are in the chat. Yeah, I was just looking through the chat and I saw some questions. Yeah, so the first question is, it opens Rialto Workforce app. Is this correct? Yes, if you've downloaded the app using the link we've given you, it will go into Rialto, but once you download it, it will show you NHS Employers once you've registered and logged in. That is the answer to that question. Can I use this app in Scotland? Yes, you can use the app in Scotland. So as I mentioned, when you go where it says London, it puts two questions there. One is the name of the job, for example, doctor or dentist or nurse, and the other one is the location. It automatically puts London. So you delete the word London and put Scotland or Glasgow or wherever you are. It will be able to look to help you to get a job in Scotland. That is correct. The reason why all those options are not there at the moment in the list is because we are trying to roll it out slowly, as in London first, then Manchester, then maybe Kent, then Wales, then Scotland, like that. But you can use it in Scotland as we speak. It's just that we're just trying to roll it out slowly. For what purpose does the... Okay, we've answered this one. The apps automatically ask that question. Many apps ask that question, but I don't know why they ask it, to be very honest with you. Could you send the link again? I've got on late. I think Oksana sent the link to that question. Ukrainians, but Homes for Ukraine isn't a refugee status. Okay, so let me tell you people, if you're from Ukraine and you're right now in the UK as we speak, and you came after the war, you automatically get your refugee status. There is no way you can get Homes for Ukraine unless you've got a refugee status. I know those things could be confusing, but I think when the war started, the government decided it's going to help people from Ukraine who have come to the UK to seek refuge. Yeah, so the people who came to the UK, some of them were supported with homes, and that is just a project or program, Homes for Ukraine. But in reality, they got refugee status and then they were supported or they were given homes. So you're automatically a refugee once, if you left after the war and came to the UK. Why was my message deleted? Sorry, I didn't delete your message. I don't know how it got deleted. If my role is CBT, psychotherapist, what position can I choose? You put in the word psychotherapist in the search inside the tool, inside the app, and click search. If you see any psychotherapist job, that is what you'll get. Okay. Is this opportunity only for England? So, England as in England, Wales, Scotland. Now, the opportunity is going to spread across the UK. However, it's not open for people who are in Europe, who are outside of the UK. So if you're in Wales, if you're in Scotland, if you're in Northern Ireland, if you're in England, the opportunity is open for you. It's just that because of manpower, we are rolling out the app from London to other parts of the UK. So it is not only open for England, it's open for other parts of the UK as well. But I don't think this is relevant. I'm a psychotherapist, not a physiotherapist. I don't know how to answer that one.
Can I stop you for a moment? We already have 2 p.m. and there are 2 hands what I think we can answer the questions.
Okay.
We have questions in the chat, and I assume if you be so kind to prepare the answers for the next session, and everyone will join next session or will see the next webinar, Anthony will prepare answers for those questions. It will be more, I think, probably we will speak, probably we will read some answers.
Yeah, we can answer them afterward.
Yeah, we can see. But Irina Glotova, let's
give me a chance. Yeah, give me the last chance, the last call. Anthony, thank you so much. I'm working with Ukrainian refugee, and I definitely will spread the word, and I will join whatever it's possible. So my question is, Anna, the registered doctor, asked you a question about the app, and you said about the feedback. So it is great that you will be helping that track the possible reasons for refusals or lack of response. Could you please explain in more details what specific candidate contact strategy will be used? So will internal staff be monitoring the journey to each candidate and then get in touch with them? Or will you have some sort of account and then with the artificial intelligence, you will have a data and then reach out the client? So I'm just trying to get this strategy, you know, how to manage this communication between your organization and the candidates. Thank you so much.
Okay, thanks, Irina. So we've asked the developers to help us identify if a person makes an application, yeah, how can we know that they have been successful? For example, yeah, if they have not been successful, how can we know that they have not been successful? Either get in touch with them, ask them to get in touch with us so that we can help them. When a job is advertised in the NHS, they advertise it on an open sort of forum, if I can put it, so that each candidate is given equal opportunity wherever they are, whether they are refugee or whoever. However, as some of you have known, maybe your friends, relatives have been to events which I have organized, and we have brought together NHS trusts, maybe 10, 12 NHS trusts, especially the ones around West London. And the event has been for refugees only. Yeah. So if we do an event and invite refugees only and put them in front of the employers or the NHS trusts, the NHS trusts would have been briefed prior that these people are refugees, so they will have different problems from the problems you usually have. So they will be considerate and understand your issues. However, if you make an application like on NHS jobs, it will be considered the same way as everybody else. Having said that, if you contact us and say, I've made this application, one, we can help you make a better application, as in help you with the application process. But also, if a person comes to us and says, Anthony, and they have done in the few past, I need, you said you have some refugee doctors. Can you send me some CVs of refugee doctors so that I can select for this post? It might be useful to them. So if I don't have your contact, I can't contact you to say, send me your CV. I've got some people who have worked with GP practitioners. There are some GP general practitioners who came from Ukraine, who are doctors. And we are doing a project to see if we can help them become GPs in the UK. So I could just go and say, look, do you have any, can you send me your CVs? And then I'll link you to the GP practice or PCN, primary care networks that usually employ GPs. So we need the information so that we can connect you to the right persons. Lastly, there are some organizations that have contacted us and they need to work with Ukrainians. They want to work with Ukrainians. And we don't know where you are unless you register with the app. So it comes in very many ways. You will find yourself in a different pot depending on where you are. Best thing is to make the best application and then we see
Thanks
how it
a lot.
goes.
Thank you.
Yeah. I wanted to mention something because this is the major. Okay. I need to first do this again and wait.
And there is last question, what we promised to answer. It was from Victoria K. And unfortunately, all other, we need to finish the webinar.
Yes, we need to finish the webinar. We've run out of time. But there are two things that usually people who try to download the app face, two problems, yeah? So, as I said, this is the list of questions that you will be asked. This is the whole list of questions. You see this word here called organization, yeah? Please, I need everybody to listen to this one. Organization. When it asks you for what organization, please select Refugee app. If you don't select Refugee app and you select the other one which says NHSP, usually it's very difficult for you to access the app afterwards. It takes you in a different direction. So always select Refugee app, London NHS Employers. That is one. The second thing is, at the bottom of the questions, tick that button there, yeah, terms and conditions, then it knows that you've agreed to sign up. If you don't tick that, it becomes difficult for the app to recognize you. Those are the only two things. No, others you need to answer them, but please remember to answer those two specific questions. Sorry, you can ask the last question and then we go, unless you've finished.
Thank you. I wanted to ask, so because I'm a student, is there an option to state that I'm studying medical allied profession in the app, or should I only register after I graduate, or at the point when I will be starting to look for the job? And also, I wanted to ask about the feedback. For example, if some Ukrainian refugee, let's say, is looking for an NHS job and cannot find, would you be able to chase with the NHS employees and ask them what is the reason for that person to be rejected? And maybe then with this feedback, you know, we can raise chances to find a job. Thank you very much.
Yeah, so that is part of the work. If a person keeps getting rejected, they will need to let us know, and then we will be able to do what? To contact the NHS organization and get feedback, but also help them, probably if it was the application form that wasn't good, and put together better application form. Yeah, the first question you asked was, if you're a student, can you register as a person who has, for example, completed? If you're not yet a doctor, then you're not yet a doctor. Yeah, but if you know, in your last year or something, maybe you can say you still haven't qualified. Yeah, but once you qualify, you can ask for the job that you want. In the meantime, you can go for other jobs that are not medical.
Sorry,
also, I just
maybe
want to.
You can add this option for the students, because there are also, you know, students that will be looking for the profession, for the role.
Yeah, the students, the options for the students are available. It's just that they are not listed. So you have to register, get the app, and then you go into the app and delete the word doctor in the search button and put the kind of job that you're trying to look for. If, for example, you're looking for medical assistant or something like that, you put the word medical assistant, yeah? And then the jobs that fall in that category will come up. But we need to know, as Oksana mentioned, we need to know how many people have got what professions. I think there is something which I haven't mentioned, which is very important. The app is not only for nurses, for doctors and dentists or physiotherapists. If you are a person who wants to work as a cleaner, the app is for you. They are called domestics in the NHS. If you want to work, if your skills are, you're a plumber, yeah, you're a mechanic, we've got some opportunities like that in the NHS. So if you fix things, you put whatever job you're looking for, you will find that job in the NHS. So if you're a healthcare assistant, if you're an admin, if you want to work in finance, IT, please look for jobs on this app as well. It's not only for clinical people, it's also for non or non-clinical people. I hope that helps. But we want to do more of these webinars so that we can help many of your friends or relatives, as many as possible. And Oksana will be letting you know when we are doing the next one, maybe next week, even the week after, so that people can download the app and we see the numbers that have downloaded, and then we can talk to the NHS Trust and say, these guys are here, they are looking for the jobs, please help them. Also share the app with your friends, because if we don't have those numbers, it will be difficult to convince other NHS trusts which are not in London that there is this problem of people not getting jobs. I think, Oksana, you can explain that.
Yeah. I will quickly want to add something in Ukrainian, Anthony, about the specific why we need this. Хочу сказати, що якщо в додатку будуть статистичні дані, де ви знаходитесь, яка кваліфікація чи не кваліфікація, яку роботу ви шукаєте, яка спеціалізація, тобто якась інформація, з якою можна працювати. Ви ж розумієте, що всі трасти, всі шпиталі виділяють якусь окрему людину для того, щоб займатися пошуком спеціалістів. І якщо вони не будуть бачити це, вони не виділять когось. А коли не буде людини, не буде процесу. Тому це такий круговоріт, коли ми створюємо попит, і тоді вони пропрацьовують у себе зі своїми працівниками, як залучати через додаток людей. Наразі лише великий траст Ентоні, також партнери NHS Employers працюють з цим додатком, але ми хочемо це збільшувати. І як тільки ми це збільшимо, буде можливість більше ролей підтягувати, змінювати щось, покращувати. Дивіться, про питання. Ми зробили запис, маю надію, що він збережеться, все буде добре. Запис ми розповсюдимо там же, де ви бачили про цей вебінар. Це буде Інстаграми, Фейсбуки, Ютуби, UMC, Юмаюк. Наступні вебінари, які ми будемо робити, ми вже будемо робити для підписників Юмаюк, Ukrainian Medical Association of the UK. Я попросила зараз Женю, вона підготує інформацію, це буде пости, ми в групах розмістимо також медиків, стоматологів і медсестер, де буде інформація, як і зареєструватися. Тобто дивіться, підписуйтесь, матеріалу дуже багато, і Ентоні відповість на питання або в письмовій формі, або ми на наступному вебінарі почнемо з питань, які були. Тобто він вже буде подавати інформацію більш змістовно з огляду ваших питань. Всі питання в чаті зберігаються, тому буде доступ. Anthony, I've just mentioned where everyone can find recording after the webinar, why we need those statistics to help new trusts, new hospitals to find special coordinator for working, for involvement, let's say, refugees from this app to the work. And all the questions you can see from the chat. If you have time, we will answer by text, and we will spread the information in the groups through Ukrainian medical community. If not, next webinar you can start from the specific answers when you understand what the most difficult for understanding with this app.
Yeah, no problem.
Okay.
Thank you very much.
Yeah, I think that's all so far. We a bit over actually spent time for 15 minutes. Thank you everyone for your time and for your questions. I believe that everyone knows as much effort you put, as much result you get. So we are helping, supporting with our British great partners. Thank you, Anthony, very much for your support, and we are continue doing this. So have a good day, everyone.
All right. Bye.
Bye-bye.
Bye-bye.
Bye.